Hello, everyone. Good evening. My name is Susan Reyna. I'm from Beacon Therapeutic, and this is CAN TV. It's a live call-in show. So for the next 30 minutes, you'll be hearing about Corporation for Supportive Housing. I have Betsy Benito here today and Christine Haley, and we'll be talking about the 100,000 Homes campaign. It is a live call-in show, so unless you want to hear us talking for the next 30 minutes, please feel free to call. The number is 312-738-1060. And as I said, my name is Susan Reyna, and I'm from Beacon Therapeutic. I'd like to put up some information about the organization. Beacon is located in the far south side. We have 4 different locations. We're a multi-service organization that's providing a broad spectrum of services for children, homeless children. And particularly, we have a special ed program. We also have an outpatient program. There's a listing of all of our programs. Our outpatient clinic. We have a FACT program that provides services to young moms ages 18 to 25. We provide early Head Start home-based services. We are one of the largest providers of mobile mental health services to homeless women and children. We have a CHIPRA program that enrolls children in All Kids Insurance here in Illinois. And we have therapeutic day schools from K through 12. And we also have an autism initiative. I'm here today with Betsy Benito, who, I'm going to get this right, is the Illinois Program Director for Corporation for Supportive Housing. And then in a few minutes, you'll also be hearing from Christine Haley. And we're here today to talk about the 100,000 Homes campaign, which Beacon has been involved with, and we're honored to do so. But maybe, Betsy, tell me a little bit about the 100,000 Homes campaign.
Sure. Thanks, Susan, for having us. So Corporation for Supportive Housing is a nonprofit organization. We're a national organization, and Illinois is one of 14 local offices.
I'm going to put your information on.
We're a community development finance institution, and so we help communities prevent and end homelessness through the creation of supportive housing. So we work here in Illinois, all through the state, and we partnered with the City of Chicago to launch a local initiative of the 100,000 Homes campaign. So the 100,000 Homes campaign was started by an organization called Community Solutions. It's a national campaign to identify and house 100,000 of the most vulnerable individuals and families in our communities.
Nationwide.
Yeah. So to date, there's 107 communities that are participating, and so far we collectively have housed over 11,000 vulnerable households.
Wow. What are some of the other cities that have been doing this?
Sure. So I should say that Community Solutions has really identified communities, target communities that have populations of unsheltered homeless persons over 2,000. So Chicago actually is not one of the target communities, but we wanted to participate out of our commitment to ending homelessness. And other communities, there's many, many communities in California that have very high rates of homelessness, street homelessness. Seattle, Portland, there's cities in Texas, New York, of course, and Washington, D.C.
That's interesting. And so who are some of the other organizations that are part of this initiative?
Sure. So Community Solutions is the lead organization, and they have generated partnerships and with entities like Bank of America, Enterprise, Community Partners, so different corporate sponsors, entities that have volunteer program. I'll describe the campaign, but it really has a strong emphasis on generating volunteers, lead entities, and really bringing stakeholders together around a shared vision.
It almost sounds like what makes this approach so unique, though, because I think I know we do a point in time count, so we're going out there trying to identify the number of homeless that are out there, but what makes this so different?
Right. So the 100,000 Homes campaign is really based on something that's called the Vulnerability Index, and that is an assessment that was developed out of some research in Boston and really looking at what are the medical factors that would advance mortality among homeless persons. What is that different between a general population and homeless persons? So who's most likely to die on the street unless a housing intervention is made? And how do you prioritize, and how do you think in the same language all together in your community about people who are homeless, and how do you see them? So what's different about this is having a common tool that everybody uses and agrees to, and it's actually then something that's used nationally that everyone agrees to. And how do you use that to identify people who are in need, who could die if they remain homeless, and how do you connect them quickly, directly to permanent supportive housing? Permanent supportive housing is affordable housing partnered with supportive services, and it's really meant to keep people stable and has tremendous outcomes. You deliver supportive housing, it's cost effective, and it drastically improves health outcomes and saves lives. So it's that's something that's unique about it. It's very energizing. It brings different stakeholders. You can engage your police department, which we did here in Chicago, your health department, which we did here, providers, government, donors, hospitals. So we brought all those folks to the table about collectively identifying people in our community who really have high risk and high needs.
And how many folks have been housed thus far? I know you mentioned at the beginning, but I think that's significant.
Sure. So to date, since August of 2010, the partners involved in the campaign have housed 92 single individuals, 35 families that represent 119 people. So in all, over 211 vulnerable Chicagoans have moved into supportive housing through the efforts of this initiative.
That's wonderful. And where have the folks been housed? I mean, just what are some of the housing options where they've gone?
So we've really worked to engage Chicago's supportive housing community. So we have a very robust system of housing here in Chicago. We have over 7,000 units of supportive housing, subsidized housing with services for people who are homeless and disabled. And so we've engaged all of those partners to see who can prioritize, who can make space in their developments when there's a vacancy, and really connect with the outreach providers who are working with people who are on the street, who it's very difficult to navigate the system. So we've tried to minimize those barriers for homeless persons to get directly into housing. I want to go over a little bit of what makes somebody vulnerable.
Yes.
So what the assessment generates is you are vulnerable if you have a minimum of 6 months of homelessness. And then it asks questions about your vulnerability. And these vulnerability factors are, we can put them up there, liver disease, end-stage renal disease, HIV/AIDS, age over 60, history of cold weather injury, 3 or more emergency room visits in the previous 3 months, 3 or more emergency and inpatient episodes in the past year, and trimorbidity. And what trimorbidity is, the history of mental health and the history of substance abuse coupled with any medical condition. So that's what those factors together would make someone vulnerable. Being homeless with a mental illness in and of itself was not found to increase risk of mortality, just like having cancer and being homeless didn't have an increased risk of mortality, but those ones that I named and we showed on the screen did. And so that's what we're capturing. And so the people that we've housed and targeted are those who are experiencing chronic homelessness, which is long periods of homelessness, really have not been helped by our homeless and our shelter system. And in many cases where our housing programs have kind of screened them out.
Because of so many barriers. Now, how did it actually get rolled out? So I know there was the registry week. Maybe describe that, because I think that really generated a lot of momentum and energy.
It did. So in 2010 is when we actually initiated the campaign. So we're past our 1-year anniversary mark. So we did the planning phase for 12 weeks, and then we did what's called a registry week in August of 2010, where we recruited over 150 volunteers from Beacon and other provider agencies and public and private volunteers. And we surveyed 3 days in a row from 3 to 7 a.m. And we went into 4 shelters to capture the family population. We surveyed over 900 persons, or we approached 900 persons, and we conducted 738 surveys. And then out of that, about 42% had this vulnerability.
And so then what do you see as like the long-term impact of this type of initiative?
Sure. So one of the goals of Community Solutions, and one of our goals here in Chicago, was to change the way we do business around homelessness and really improve access to housing for people who are homeless. What we're finding through our research, and there's evaluations of our 10-year plan to end homelessness, is that people who are on the street and in an emergency shelter are getting stuck there. Our housing programs have varying eligibility criteria, barriers to entry, and there just aren't services that help people navigate that system. And so what we wanted to do here was to change that, to have outreach providers, people who are on the street, who are in shelters, to work together to share information. People who completed the survey, signed a release, so that an organization like a Heartland Health Outreach and an organization like Thresholds, who are out on the street, can actually talk about that same person and reduce duplication, and then really identify what type of housing that person is eligible for and match it with who's come to the table and is offering their housing. So it's continued to grow. It's continued to change the way we do business. And it's where we can work with all housing providers then to reduce their barriers and actually set a priority for people who are vulnerable in our homeless system and on our streets, so that they move into housing much more quickly.
Of those 700 folks that did complete the survey, how long is the list that was identified?
Sure. So out of the 629 individuals completed the assessment, and 262 were determined to be vulnerable.
Wow.
And out of the families, which Christine will talk about in a moment, 107 were surveyed, and just over 30 were found to be vulnerable.
And I know, we'll talk a little bit about the families, because I think that's really continued to evolve. So what's the next steps with the individuals? And I know what's the next steps? What are the goals for that in terms of the individuals?
Sure. So we're Heartland Health Outreach and AIDS Foundation of Chicago, who's the on-the-ground facilitator of the outreach and housing placements for people in the campaign, continue to engage folks and conduct the assessments and link them with housing. What we've done here is sort of evolved into how we bring all housing providers to the table to prioritize housing placement and housing access in order of vulnerability, so that we're ensuring that people have a chance. It's a little bit more predictable, and that we're targeting more effectively. So it's really just shaping our approach as a community to housing.
So do we think that we'll start administering the tool again, the vulnerability index, at some point for new folks?
Yep. So what our hope is that we will, for individuals, it's continuing to be administered, but on a pretty small scale. So what we're hoping is that we'll develop a more public access tool, some sort of electronic tool, some way that individuals can fill out an assessment that would still be confidential and put themselves on a list, so it'll really improve access and then continue to take people on a wider scale. So our community planning body, for those out there is something that really is a public-private entity, the Chicago Planning Council on Homelessness, and has agreed to ask all of the agencies and all of the supportive housing programs in our continuum to prioritize based on this vulnerability index. So it'll have long-lasting impact because it'll help supportive housing programs change how they move people in.
And actually, this is a good transition, because I'm going to put some pictures of some of the families that we're talking about. We're going to start talking about families. So if anybody's just joining us, this is CAN TV. It's a live call-in show. We're very honored to have both Christine Haley and Betsy Benito here from Corporation for Supportive Housing. And we're talking about a great initiative here in Chicago. It's a national initiative where we're talking about the 100,000 Homes campaign and the wonderful work that's been done here in Chicago because of very energetic and enthused folks that really are making a commitment in order for us to be able to really respond to the needs of the most vulnerable. And in a few minutes, we're going to have Christine, who really has been working with Beacon on the families component of the 100,000 Homes campaign, which of course is something that's near and dear to my heart. So welcome, Christine.
Thank you. Thank you very much.
Christine, and I'm going to get your title right. You're the Associate Director at the Corporation for Supportive Housing, and I know you've been integral in the family component of the campaign. We were talking about Betsy a few minutes ago in terms of the broader scope of it. So tell me a little bit about what are some of the work that you've been doing on the family portion of the campaign.
Sure. Thanks, Susan, for having me on and for having us on to talk about the campaign. I'd say that we were the first community in the country to really look at homeless families and how to prioritize homeless families. So we, during Registry Week, went to 4 family shelters in the city and administered the Family Vulnerability Index tool to try and identify who were the most vulnerable families. And so we are at the point of, after working with a number of organizations to help house families, at the point of being able to revamp the family campaign and start afresh and really looking at who are the most vulnerable families in our community.
Yeah, we'll talk about that in a few minutes. We have a caller. Is there a question?
Yes. Good afternoon, ladies. How you doing?
Fine.
And first of all, I think you're doing a wonderful job. I mean, seriously. But I just spoke to a lady today, and, I was just listening. I did not say anything. And she was discussing about how long she'd been waiting for Section 8, I think that's the word, Section 8.
Sure.
Yeah.
Yes.
And but anyway, she said, I've been waiting for years. And is that really true? People have to wait that long? And if so, why? I'm assuming there must be a lot of people. But for years, Jesus. But again, I'm not knocking it. But if you could just explain a little to me, that's something I don't know about, but I'd like to hear. And also, again, good show, and keep on helping people.
Thank you very much, and thank you for that question. Christine, I'm hoping you can respond to that, because I do know that is a real challenge. There's a lot of waiting lists for a lot of things, and I know Betsy a few minutes ago was talking about one of the benefits to this, on the go forward, is that there'll be perhaps a better allocation of the resources. But, I mean, can you comment on that? Why is there such a long wait for Section 8?
That unfortunately the need just far exceeds what the available resources, so that the housing authorities are able to open up their wait list for certain periods of time, and once they're closed, there are just over 10,000 people, I'd say, thousands of people who are families who are waiting on the wait list. And as new units are available and become available, they are able to offer those units to those who come up on the list. But unfortunately, the demand is just so high that we don't have the resources to meet that. And so part of the work with homeless families that we're doing with the campaign is figuring out how we can serve those families who are the most vulnerable and at the most risk of a family separation.
And I think that's what some of the exciting work that's been going on in terms of really being able to develop a tool that's meaningful, that, everybody can say that, this is a family that really should be housed right away. Not that they don't all need to be housed. Everybody, that's basically right. Everybody should have good housing and stable housing and safe housing. But reality is there are limited resources. So tell me, what are, you emphasized that Chicago was one of the first that really decided to embrace the family piece. And I was so excited about that. And I know, we did the first one. And then we learned a lot, and now we're at the second one. So what has been the process in developing the vulnerability tool?
Sure.
So
I'd like to just recognize that this all across the board with 100,000 Homes campaign has been about collaboration and about working together. So there have been so many agencies who have come forward with their best and brightest thinkers around how to best serve homeless families, to think about how can we change the system, and to recognize some of those entities. Susan with me from Beacon, others from Heartland Health Outreach, Heartland Human Care Services, from AIDS Foundation of Chicago, our public partners from the City of Chicago, as well as from the Department of Children and Family Services, came to the table to really think about how do we identify those families who are at highest risk. And we decided to really look through the framework of families, through the lens of the families who are most at risk of family separation. So those whose children are at highest risk from being removed from the home, and really looking at that family structure falling apart and falling apart. So can the intervention of supportive housing be used to help ensure that families stay together, that they're kept together, and that the whole household's outcomes improve? So really looking at how children thrive when they have a home that they can go home to each day. So
We do have a caller. Is there a question, caller?
Yes, hi. I just have a question. Once the people are housed, and then do they receive their wraparound services through Beacon Therapeutic? How is Beacon Therapeutic involved?
Good question. Well, a couple of ways. I mean, clearly Beacon was involved with the initiative where we were, when Christine spoke earlier, or I think Betsy did, in terms of going into shelters. We were one of the lead folks that really took that on to implement the vulnerability index within the family shelters. And then thereafter, we've been actively involved with, the systems integration team in terms of trying to be able to allocate the resources and be able to be involved with the family, because the majority of these families are families that we've been working with already. And the goal is that once they've been housed, is we've continued to follow them. And there's different partners that have been housing them. So I know Inspiration Corporation and actually, they're the ones that come to mind real quickly. But I know there's other organizations that have been housing some of the folks. And Beacon doesn't operate housing per se. We're providing the wraparound services. So we will continue to support the families once they are housed. And that's the work that Beacon has been doing. But I do think that, Beacon in particular really has taken on a strong role in this. And we've been very happy to do that. And I think this is kind of in line with what we've been doing all along. So, tell me, Christine, what are some of the outcomes? What are some of the indicators from the numbers that from the registry week on families that we were able to see?
Sure.
And I know you have a slide on
Sure.
that.
So we can share with you. These are some. This is a sample of the 31 families who were surveyed, just a sample size, so we can look at some of the characteristics of the families. So most of the families had children under the age of 6. 97% had children under the age of 6. The head of households having domestic violence histories, 58%. Also with a substance use condition, 77%, and also a number of families with the heads of household under the age of 30. So these are some of the just to talk a little bit about the families who we're serving. And the agencies that work to house the families and provide the supportive services really included Inspiration Corporation, who were able to house a number of families, as well as Inner Voice and Renaissance Social Services were the primary agencies that worked with us to provide the housing, and also, once a family is housed, being able to continue to support them in their homes.
And I think that's what, we were talking about this earlier in terms of developing this common language. And I think, recognizing there are such limited resources, and how can they be, how can those most in need, and I think particularly with the family piece, and you were saying it earlier, is that, it's having long-term impact. So for housing families, we're reducing the impact of trauma on the children, in terms of them being separated from their families. So I know, Department of Children and Family Support Services is interested in this, and what can we do to stop? Because I think homelessness is the number one reason why mothers do lose their children. And with this type of initiative, we're eliminating the family separation simply because the family is homeless. So where do you see some of the future directions for this initiative?
Right. So in the next few months, we will be administering our new vulnerability index tool across shelters across the city of Chicago. So any family who's living in the city of Chicago, we hope to be able to reach to identify them with these risk factors, and then really reach out to our permanent supportive housing providers to match up the housing resources so that those housing resources are available. This will also be part of a national campaign. So Community Solutions and the 100,000 Homes campaign plan to pilot the tool that we've developed here in Chicago in 5 communities across the country, and it will just continue to grow. Right. I do want to recognize that our national team helped us and provided wonderful expertise for us in developing the research part of this. So
And
they
I know
were
that
great
was one of the big
partners.
things, is that in developing the tool, there was a strong emphasis on making sure that there was research to support what was being included. And
Mm-hmm.
I think that was really helpful. And I know some of the data sources for that was, I know, the Keeping Families Together initiative.
Right.
I know the fact data that we used, as well as some other data. So I think that's what was really helpful. So
Can I let people know what they can do if they are interested
Yes.
in helping?
Yes.
So, as many of us know who have moved from time to time, when you move into a new place, that it's very difficult to have all of the supplies that you might need in order to move into a new home. For example, pots and pans and towels and those pieces. So we partnered with the Emergency Fund through the 100,000 Homes campaign to be able to provide those resources to families that are moving into new homes. So if you are able to help donate to that piece, we please welcome that in contacting the Emergency Fund and letting them know that you're interested in donating to the 100,000 Homes campaign.
that's great. Any other final comments? We have, I don't know, a few seconds left.
Also, if you're a landlord who has an
right.
apartment that you are interested in renting to a family who it has, or an individual who's previously experienced homelessness, please feel free to contact us. We're looking for landlords who are interested in joining the cause. Again,
Yeah, I'm going to put this information
Sure.
up because I think, our need for landlords is quite profound. So I think if you're interested, you can call CSH, or you can always call Beacon. And our number is 773-298-1243. Again, it's been a great show. Thank you, Christine.
Thank you.
Betsy.
Thank
Really
you.
appreciated you being with us today. And we'll see everyone again next week. Thank you very much.
Thank you.
Bye-bye.